The human tongue, often overlooked in everyday life, serves as a vital diagnostic tool for doctors during comprehensive physical exams, offering crucial insights into our overall health through its appearance. Its color, texture, and any coatings or lesions can signal various underlying conditions, ranging from minor issues like infections to more serious diseases such as those linked to leukoplakia. A healthy tongue typically appears pink, moist, and is covered with small bumps called papillae, which give it a rough texture and house our taste buds for sensing flavors. While the shade of pink can vary slightly among individuals, a healthy tongue should always be free of cracks, ulcers, or any unusual lesions that might indicate problems. Now, let's explore in detail what different tongue colors can indicate about a person's health, drawing from medical observations. A pink tongue is generally a sign of good oral health, indicating proper hydration, functioning saliva glands, and healthy papillae without any abnormalities. However, a white tongue can point to several issues, including poor oral hygiene, fungal infections like oral thrush, autoimmune conditions such as oral lichen planus, or precancerous changes like leukoplakia. A yellow tongue often results from bacterial overgrowth due to poor oral hygiene, dry mouth from reduced saliva, smoking, or chewing tobacco, leading to a coated appearance. Rarely, a yellow tongue might also be a subtle early indicator of jaundice from liver issues or uncontrolled diabetes affecting oral health. An orange tongue is similar to yellow, frequently linked to poor oral hygiene, allowing bacterial buildup and sometimes dietary factors or medications. A red tongue can signify vitamin B deficiencies like B12 or riboflavin shortage, bacterial infections such as scarlet fever, skin conditions like eczema, or inflammatory diseases. A distinctive strawberry tongue with red background and white coating is common in scarlet fever and Kawasaki disease, while red patches with white borders may indicate the benign condition known as geographic tongue. If your tongue appears purple or bluish-purple, it could suggest poor blood circulation, cardiovascular problems like heart disease, or vasculitis conditions such as Kawasaki disease. A blue tongue is a more serious sign, potentially indicating poor oxygen circulation in the blood, often related to respiratory issues like lung disease or renal problems like kidney failure. A gray tongue may be associated with digestive issues such as poor gut health, peptic ulcers in the stomach, or chronic skin conditions like eczema. Finally, a black tongue is often attributed to overgrowth of bacteria from poor oral hygiene, smoking, certain medications like antibiotics, or metabolic issues like diabetes. This condition, known as black hairy tongue due to elongated papillae, is usually benign and can be resolved with improved hygiene and hydration. Beyond color alone, other tongue signs include changes in texture, such as swelling from allergies or infections, unusual smoothness from nutritional lacks, or deep fissures that run along the surface. Thick coatings on the tongue can reflect poor intestinal health or microbiome imbalance, while persistent pain might signal infections, inflammation, injuries, dental problems, or vitamin deficiencies. Specific conditions like geographic tongue with map-like patches, fissured tongue with deep grooves, hairy tongue with elongated filaments, and median rhomboid glossitis with a smooth red patch present with distinct visual characteristics. In traditional Chinese medicine, the tongue is seen as a detailed map of the body, with different areas like the tip for the heart, sides for the liver, and center for the spleen corresponding to various organs. TCM practitioners assess overall health by carefully examining the tongue's color, shape, thickness of coating, and texture to diagnose imbalances in the body's energy and organs. Regularly observing your own tongue in the mirror for unusual changes, such as persistent discoloration or new textures, is an important part of monitoring your overall well-being and catching issues early. Dentists also routinely evaluate the tongue during checkups, looking for any signs of oral cancer precursors, infections, or systemic health issues that require referral. If you notice any persistent changes in your tongue's color, texture, shape, or experience ongoing discomfort or pain, it's crucial to promptly report them to a healthcare professional for proper evaluation. Your tongue truly is a window into your health, providing early warnings through its changes that can help prevent more serious conditions from developing undetected.